Hello, YouTube family and friends. Sorry that this weekly video, is coming out so late on ya. I got back from my Christmas cruise late Friday, and yeah, Saturday and Sunday I just wasn't with it. I needed to relax. The cruise was okay. I had some bad parts to it due to my myasthenia gravis, and just around the holidays. It's holidays, especially Christmas, has never been a good time for me mentally. So I struggled early on with the cruise, with the mental, and also just dealing with some muscle fatigue due to my GMG. So, but it ended up being good the last few days of it. I did get to swim, well, not swim with dolphins, but interact with a dolphin in the water. That was awesome. I did that at Blue Lagoon Island. It's at Nassau, Bahamas port. So that was great. And then the last day of the cruise, before we got back home, was the Carnival's Celebration K. Some people call it Celebration Key, some call it Celebration K. It is what it is. So, but yeah, it ended well. Though every night I went to bed early. I was just fatigued, tired. I've said this before. I'm just extremely tired all day, every day. But I wanted to push myself on this cruise because I wanted to enjoy it, especially with the first day, which was just our one and only sea day. I was in my headspace, and so I didn't get to enjoy it. So I really wanted to enjoy it the 2 days after that. So I really pushed myself each day, and that just, yeah, I was in bed by 8 o'clock, 9 o'clock, something like that. Yeah, and I didn't get out of bed. Uh, well, I had to get up early for the excursion at Nassau, and I normal time get up on the final day for a celebration K. So, but yeah, it took a lot out of me, uh, tired wise, of my extreme fatigue that I have all day every day, as well as my GMG, myasthenia gravis, muscle weakness. So, but it turned out okay. I had when I was in the water, standing on the platform they had underneath the water, so the dolphin can swim up to us. My legs were a little unsteady, a little wobbly. Then I was a little worried, but thankfully it was a big enough platform, and I was able to kind of steady myself and position my feet in a way where it helped me keep my balance better. So, yeah. So that was a cruise. If I'm able to, I'm going to paste a picture with me and a dolphin as the cover of this video, if it'll let me do that or not. We'll see. Obviously, if you see this video, you already know if I was able to do that or not. So, but anyway, this is my week 92 results of being back on Mounjaro while I deal with a host of medical issues. I'll start it off with my weight. Uh, I, I'm not counting my weight on Saturday and Sunday because every time I go on a cruise and, of course, fly back, like the cruise food makes you, I don't know if I heard it's something about salt intake or the water, it just causes you to retain water on cruises and the flying. I don't know, but that's what I've heard. And it does happen to me every single time, even when I don't pig out. I kept control of my eating on this cruise. I only had one ice cream cone, which was amazing for me. And I had salad, and so I had a few cookies, but they're tiny cookies. So yeah, I did good on eating and my water intake. So, but anyway, last week I weighed in at 215. Today, which is Monday, uh, December 29th, 2025, I weighed this morning at 214. So it dropped me 1 more pound. Yay. So I'm now at a total weight loss of 22 pounds for the 92 weeks of being back on Mounjaro. So yeah, I'm happy with that. So, but a little bit of updates. Oh, I got my pre-stuff for my colonoscopy and endoscopy that I get to have on January 12th. And I'm so looking forward to that. And they said they sent the order in to my pharmacy. So I'll probably get to pick that up in a few days. I just love drinking that nasty stuff, and the flavor stuff that they give with it makes it worse. So I just don't even add it anymore. This is my, I think, 4th colonoscopy. So yeah, I just drink it straight and just plug my nose and pretend like I'm drinking something good. So we'll see how that happens. It's 2 more weeks. Again, I've already talked about my last day, my official last day of employment is January 15th. So I'll get my final paycheck then. I will be officially off insurance at that time, all benefits. At the end of the month, for the last day of the month paycheck, I won't get a regular paycheck, but I will get paid for all my vacation leave that I haven't used yet, which should be a good amount. So, yeah, and then I'll get a bonus payout since I'm still employed technically on 31st. Well, it's 2 more days. Hopefully, I should still be employed by then. So I'll get a nice bonus in February to help me. But I haven't heard yet from MetLife, who is doing my long-term disability review for my employer. So hopefully I'll hear something early January, because if I get improved for that, I will be able to pretty much keep my work insurance, which is really good insurance. I just have to pay the premium, but I'll get a discount on the premium for the number of years that I worked for them. I worked for them I started in September of 01, and so it's been slightly over 24 years that I've worked for the company. So, but we'll see what that falls. I hope I get approved so I can figure that out. So, but if I don't, if I get denied, then I'm going to have to make that vacation payout and the bonus payout in February work for me until I get access to my 401k funds. I was told by Voya that I have to wait 31 days from my termination date before I can get access to those funds. So it won't be, so my termination date will be January 15th. So the earliest I get access to that funds will be February 15th. And of course, I just don't get the money right away. It's going to take a few days or however long, whatever process it is, to request a payout of amount from there. So I can pay some bills off possibly, or just get me by for a while until I decide whether or not to file bankruptcy on all my bills. But I don't want to do that until I'm able to file bankruptcy on my student loans. And I have to be permanently disabled for that. So if I don't get qualified for long-term disability through my work, I'll go ahead and apply for it through SSDI. But I'll get an attorney involved with that to help me with the application, because most people get denied right away. So I'm really hoping with the help of an attorney, I will get qualified the first time. Or if I don't, they'll be able to know what to do to reapply again and all that fun stuff. So, but anyway, there's the update on that. So I did reach out to a law firm today concerning my thoughts on possibly filing a medical malpractice lawsuit against the Inspire device company and possibly my ENT doctor and the nurse. I think I've talked about this before in my previous videos. Stitch just wants to cuddle. But yeah, so a brief summary with me excuse me, losing my voice. Uh, I have liver cirrhosis that is from non-alcoholic fatty liver disease. I have obstructive sleep apnea, and of course, I have autoimmune disease, generalized myasthenia gravis. I'm type 2 diabetic, which that's under control right now thanks to Mounjaro. So I have other issues. Sometimes I have bladder issues and prostate issues, so I'm on medications for both. I sometimes have kidney issues, not major, but sometimes I have fluid buildup in the kidney or the underneath section of the kidney. So, but anyway, uh, I really was struggling on to decide whether or not to proceed with getting the Inspire device, which is a nerve stimulator implanted, where the stimulator is wrapped around the nerve that sends signals to the muscle of the tongue to move forward. So every time I take a breath when I'm sleeping, my tongue will move forward so it won't collapse and block my airway. And then there's a wire right there that goes down to the battery that's in here. And I was told many times, reassured many times, that this new Inspire device is made to be able to allow imaging, including the MRIs, because they all knew, ENT doctor, the nurse for the ENT doctor, and the Inspire rep. They all knew, because I made sure, as I was thinking about it, I kept on asking, "Are you sure? Are you sure?" And I kept getting reassured, yes, you know, you will have an MRI, no problem. They'll just have to follow some guidelines, some restrictions, but you'll be able to get an MRI, no problem. They said that to me several times, and I got my packet from Inspire, which has a document in there saying that I can get MRIs. So I trusted them, because that was the final factor with me deciding to get the Inspire device implanted. And the Inspire device has been going great for me. I had my new overnight sleep study done. Was that over a month ago? Maybe 2 months now. And it showed that it's working great. I only had a minimum amount of instances where I stopped breathing and my oxygen level dropped down into the 80s. It's just minimum episodes. The sleep study doctor, or whoever she was, who did the sleep study. So she said it's working absolutely brilliantly. It's doing what we need it to do. So that's awesome. Well, a little bit after that, I had my regular follow-up with my liver doctor. And she says, well, we need to get a fibro scan on your liver just to see to get a feel of how hard it is, and take a look at a couple of other things. Stuff that regular ultrasound just can't determine or can't pick up. So she says that, let's get the fibro scan. Well, unfortunately, the fibro scan the test results came back as unreliable. That's the technical term for it, unreliable. That means for some reason or another, the test could not get a good reading or consistent readings on it. There are several possibilities of why. So my liver doctor said, well, we need to go ahead and get an MRI done. It's called a liver lab, or MRI liver lab. As also part of elasticophy, something like that, where it's a 90-minute session of an MRI where they do several things, and it'll get a good reading of how hard that liver is. Because they actually put some type of pad over where the liver is at, and it'll bounce singles off of the liver to pick up. See how far. If the signals come back quickly, that means the liver's really hard in that section. If it takes a while for the signals to bounce back, it means it's not as hard in that section. So we do that. And then also the MRI, the other part of the MRI, can give you a really good view of the liver to see if there's any lesions in it and around it. The ultrasound kind of picks them up, but it's possible that it's not able to pick if there's any of them on there, maybe in a hiding place. The ultrasound can't always be totally accurate on that. So the MRI would be able to tell for sure if there's any lesions in the scarring or wherever, which would be cancerous for us to worry about. So, and they also can get a better view if there's any ascites, fluid buildup, and I think there's some other things. So that's why she wanted to have an MRI done. Well, I called the registration to schedule my MRI, and she just asked me a bunch of questions, which is normal. And then she came back. One of the questions was, do I have anything implanted in me? And I said, yes. I have the Inspire something nerve stimulator. That's for my sleep apnea, where I have the stimulator wrapped around my nerve in my neck. And then I have a wire that goes down into a battery that sits in my chest. And then there's another wire that goes kind of down into the rib. That is the kind of like the sensor, so it knows when I take a breath in, the chest expands, so it picks it up, and that tells the stimulator to stimulate that nerve to get the muscle to move the tongue forward. So that's what it does. Well, she says, well, no, unfortunately, we can't do MRIs on that device. It's like, oh, no, they reassure me I can. That's the main reason why I went ahead and got this implant, is they kept reassuring me that I can. So, but I also told her that, no, they said I have the newest device, which is made to be able to do an MRI. Just have to follow some restrictions on it. So she's like, okay. She said she'll get in touch with radiology to see what they say. And radiology came back and actually called me directly and told me that, no, you can't have an MRI with that device. So I was like, okay, let me reach back out to that ENT doctor or nurse. And so I messaged the nurse through my chart, and I let her know what the radiologist says, and told her I was not happy right now. And so she replied back saying, well, you should be able to get this done. But she said, let me reach back out to the Inspire rep and see what they say. And she reached back out, and she called me, I think, or she called me initially. Yeah, I sent a message. She called me back instead of sending a message, saying that she even said, I remember us talking about that. I know that you were really worried about that, be able to get the scans. And yeah, we've been told that you can. So, but she reached out to Inspire, and she got back to me through a message saying, the Inspire rep said you can get one done. So she said she gave me a phone number to give to the radiology department to have them give Inspire a call to go over and make sure that they got the right documents for the restrictions. And so I contacted radiology again, and she said, okay, she'll give them a call. So after a while, she called me back. I think it was the next day she called me back. And she's like, I'm sorry, but we got hold of the Inspire rep, and I had the right documents from online. So they said I had the right documents, and I told them we cannot do it based on the restrictions. So she told me I was misled. The radiology person, she told me I was misled. Yes, you can have an MRI on other parts of your body, but due to the really strict restrictions, I will never be able to have an MRI of my abdomen because of the Inspire battery. It's like, what? She didn't tell me what the restrictions were. She just said they were too strict of restrictions that will prevent anyone from doing an MRI of your abdomen. Oh my God. So I reached back out, sent another message to my ENT nurse, who I've been kind of communicating with, the nurse, the LPN, and I told her what the radiology person said, and I told her I am pissed right now because you guys reassured me many times because I kept asking to make sure. And she's like, well, I'll have to contact Inspire and see what they can do or see what they say. It's like, okay. Well, a couple of weeks gone by, she never contacted me back. So I sent another follow-up message to her saying, I haven't heard anything. Are you guys still working with Inspire to see what can be done? And she did reply, and she said, well, we're still working with them. They haven't got anything to me back yet, but I'll let you know when they do. So, well, it's been I think it's been like 3 or 4 weeks since that one. Actually, it might be, about a month now. I think that was late November. And I still haven't heard anything from them. And so as you know, I'm dealing with mental health because of all my medical issues. And I'm seeing a psychiatrist and a therapist and dealing with all my medical issues, especially with my GMG, the autoimmune disease. The symptoms are getting worse. I've got new symptoms. So, and like I said, I'm more tired. I'm extremely tired all day, every day. Excuse me. And now I'm worried that I have liver cirrhosis. I have to have an MRI done. So what I did was I sent a message back. I sent a message to my liver doctor and let her know gave her an update again. And I told her it sounds like we will never be able to get MRI on this liver. It's like, so I asked her, I know you said that for now, she thinks we're okay. And if push comes to shove, we could always do like a 3T or 3 something CT scan that could give us some information, but it doesn't provide everything. So, but we could try that. But she said, unfortunately, I can't guarantee you one way or the other if you'll be able to escape by with never needing an MRI. Or, no, like I said, my question is, will MRI definitely be needed at some point in the future when my liver cirrhosis progresses, especially into decompensated stage, so we know exactly how far gone the liver is, and so we know what treatment to start with when it goes downhill. And she's like, like she said, she can't guarantee it. There's a good chance that you'll definitely will need an MRI at some point in the future. But she said, we'll deal with it as when that comes. So it's like, I'm struggling with making 2 decisions. I can go through another major surgery, which surgeries are a risk for me because of my autoimmune disease, my generalized myasthenia gravis. Going under anesthesia. This is the major surgery, so I'll go over strong anesthesia. That can cause me to go into a myasthenic crisis. Sometimes not during the surgery, but the next few days afterwards, it can send me into a myasthenic crisis. So I'm at more of a risk from anesthesia due to my myasthenia gravis. So, but then, and put my body through another damn surgery. I had 2 surgeries already this year. Or I can gamble, keep it in, and pray to God that my cirrhosis holds steady for a good 15, 20 years. And my battery pack will need replaced after 10, 11, 12 years. And at that point, when it's time to replace it, I could then maybe just say, instead of replacing the battery pack, just take it out. But it's a real gamble because my cirrhosis, it's incompensated, but it's borderline decompensated, because I have portal vein hypertension, which is causing the blood flow not to go into the liver smoothly. And so it's kind of like a traffic jam where it backs it up. I got an enlarged spleen because of the blood backing up into it, which enlarged spleen means it pulls more blood, pulls more platelets out of the blood and stores them. So it makes my platelet count low, and my platelet count, it keeps getting lower. The last blood work I had a few weeks ago, it was at 113. And as long as it stays above 100, I'm good. But at one point, a little over a year ago, it was at 161. And now it's just dropped, 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 dropped. And if it goes under 100, that means I'm more susceptible to bleeding out, that my blood won't be able to clot well enough. And if it drops to 50, I'm in severe danger. And I would have to take beta blockers. But as my liver doctor said, because of my other medical conditions, I will not be able to go on beta blockers. And as well as that makes it more dangerous because I have a small varices in my esophagus. Well, it was small 3 years ago. That's why I also have an endoscopy done with the colonoscopy. So on the 12th of January, I'll have both colonoscopy and an endoscopy to see where that varices is at. Did it get bigger? Is it the same? Is there more than another one? Is there more in there or whatnot? So, and my platelet counts drop below 100. That can really cause me to bleed out. If that varices, esophageal varices is what it's called, if it bursts or even starts leaking, I could bleed out and I might not even know it unless I start to feel really bad or I start to cough up blood. I might not even know that I'm bleeding internally. So, and of course my colonoscopy, no, each one I keep having more polyps taken out, and they are precancerous polyps. So that's why I have that done every 3 years, with the 3 years for every endoscopy. We just get them done at the same time. So I am struggling big time on this decision. I don't know what to do. And like the liver doctor can't make that decision for me. No one can make the decision for me. It's on me to make that decision, whether or not to gamble and leave it in for now and hope nothing happens where I definitely need an MRI. By the time the battery has to be replaced, so then you have to make a decision and pull the battery out and put a new battery in. At that time, if it's still in, I'll just have them take it out at that time. Since they're going in there anyway to take out the battery, put a new one in, they can just pull the wires, and they'll have to make an incision back up here again to take the stimulator. It's like a wrap thing around the nerve that stimulates it. They'll can pull that out too. So, but I don't know. I'm sorry, folks. I really wanted this video to be super, super short, and we're at almost 28 minutes now. But I really wanted to give you that update. The attorney that I called, that I'm familiar with, I wasn't sure if they did medical malpractice lawsuits. And when I called and talked to one of the attorneys there, he said, well, because I told him my story about, now, they kept reassuring me. So that was my final thing to get me to decide to get it. And now, instead of having an MRI, I can't. And so that's why the radiology person said I was misled. And I told him that, no, my liver doctor says I'm okay right now. We could possibly do a CT, a three something CT, but that doesn't guarantee it'll get us everything that we need. And there could definitely be a point in the future that I absolutely will have a need for an MRI. And if I still have this thing implanted in me, no, I'm screwed. Unless I can quickly get it taken out, and as soon as it's taken out then and healed, then I can go do the MRI. But that's gambling. And so I'm just like, I'm so angry with them. I'm so angry with them that they put me into this situation. If they would have just said, yes, this new device is made to have an MRI, but with the restrictions, it's possible, depending on what type of MRI you need, you might not be able to get one. If they would have just said that would have made my decision a no, and I would not have got it implanted. So it's like now I'm struggling. It's just I'm already dealing with mental issues, and this is just blowing up my mental issues even more. I see my psychiatrist this coming Wednesday, so I'll talk to her about it. But I mainly talk to all this stuff with the therapist, and psychiatrist mainly is just medication and what to do. We're still tweaking it. Been seeing her for 4 months now, and she's still tweaking my medications. So, but anyway, the first one I called said they don't actually do that, but they said you might have a case here. So they referred me to another law firm, and they said they refer a lot of people with with medical malpractice cases to this person at this other law firm, and they're really, really good. They will be able to review your case, and you can trust what they tell you. If they said, I'm sorry, we just don't see a winnable case here, then you can believe them. Or if they said, yes, we believe you do have a case, then definitely, if they say it, no, you should take what they say. So, yeah. So that I talked to like the receptionist or something there, and she started. I told her what it is, so she started recording my call. She took notes, and I went through the story all over again. And she was like, "Yeah, you might have a case here." So she said what she's going to do is she's going to give this over to the attorney, let him review her notes, and let him listen to the recording, and then he will or she will call me back to see what are the next steps, if any. So, okay, folks, that's it. We're past 31 minutes. If you made it this far, thank you. Thank you for listening to me. This is kind of like another therapy session for me where I can just, at least I didn't struggle to get it out and almost cry like I did in my last week's video. So, but anyway, I hope you had a Merry Christmas and you all have a great, happy New Year's, and be safe. If you're going to indulge, there's no issue with that. Just make sure that if you're not doing it at home, that you have a designated driver, or if your city has like Ubers or taxis that give free rides on New Year's Eve night, please take advantage of them. You don't want to lose anybody. We don't want you to even think that if you're close borderline what you think you can handle, don't drive. Please don't drive. It's better not even to drive. You're going somewhere, don't drive there. Just take an Uber there, or a Lyft, or taxi, or whatever's in your area, so we can make sure that you get home safe, as well as no one gets hurt if something's happened while you're driving home, a little buzzed or big buzz. So it's just not worth it, folks. It's not worth it. So, all right, y'all take care, and I will see you in 1 year, or you'll see my next video in 1 year. All right, I love you all. Bye-bye.